Hi, everyone. My name is Misha Severson. I do work with the TeamBirth program. I'm here with a colleague, Lindsay Renner, and we will give you a quick overview of what TeamBirth is. And then I know Melissa will talk a little bit about smooth transitions. Um, then I would really love to talk to you about the connection between utilizing TeamBirth to really elevate transitions that do happen, especially from the community to birthing facilities. And then, as Rua just said, hear your feedback. We have a really specific tool that's being developed, and we would love to hear what you think and if it's the wording and the message lands with you. So that's really a really important part today. So I want to make sure we get to that part and have time for questions as well. Go ahead.
Yeah, thank you all. I just feel like Sarah and I, the Smooth Transitions folks, are recognizing most everybody that's here. I know it's been a long time, probably several years. You've probably heard us at Smooth Transitions talking about TeamBirth. And so we're really happy to be able to just kind of do a little bit of a deeper dive into what it is with the TeamBirth folks and their partners at Health Commons and the exciting work that's really happening all across the state, which I feel like is going to be really relevant to community midwives, especially in a transfer situation. For us, as most of you know, that kind of warm face-to-face provider to provider interaction that we hope can happen with the whole hospital team at bedside is really, it's been our standard for even before TeamBirth was really operating here in Washington State, and we're still kind of holding to that as it's kind of rolling out at different hospitals. And really, that just is kind of twofold. It's, bringing and welcoming the community midwife in as part of the healthcare team more formally through, a systematic approach, which I think is more sustainable. Hopefully get around some challenges that we've all experienced with, mistreatment or bias or kind of different equity issues. But I feel like, as you'll learn more about what it involves, like kind of working together as a group, I think will probably discourage some negative treatment that community midwives can experience and definitely their clients. So I hope that, thank you for all of you for coming. I know every single one of you is really busy and I don't want to take up any more of your time, but we'll get started, and I'm excited to get everyone's feedback on this resource, and that's part of the purpose today.
So I work with Ariadne Labs, again, Misha Severson. I do have an obstetric nursing background. And now I get to work with all the hospitals, many across the country, but I'm integral in the implementation of TeamBirth across the country. And I have a whole team I work with. And one of my colleagues is here today, Lindsay Renner. Lindsay, if you wouldn't mind just talking briefly about TeamBirth and Ariadne Labs, and then I'll explain what TeamBirth is.
Happy to. Hi, everyone. I'm Lindsay Renner. I'm a research coordinator on the team at Ariadne Labs. So Ariadne, that is where the TeamBirth solution was designed and where it's housed. We are a joint center for health systems innovation at Brigham and Women's Hospital and Harvard T.H. Chan School of Public Health. So kind of sit right at that juncture of public health and acute care delivery. At Ariadne, we work to design, test, and spread systems-level solutions that address what we call the no-do gap that I'm sure many on this call are familiar with. But the no-do gap being those failures to translate really what we know should be done in clinical practice. So that those evidence-based solutions, the failures to actually get those to the right patients at the right times. What you all will see on this slide also will not be new to those on this call. We know that better communication in maternity care is vastly needed. And it's often simple communication solutions, those solutions designed to really address breakdowns in teamwork and communication that improve patient reports of autonomy, trust, and respect. So TeamBirth is one of those solutions really designed to address these breakdowns by providing the tools and behaviors to promote patient-centered care for patients delivering everywhere. So Misha's going to get into more of what TeamBirth is in a moment, but we wanted to make a connection for you all that TeamBirth, this initiative is spreading, and in two states in particular, that spread is really impactful. Washington is just about 1 year into a statewide implementation of TeamBirth, so really to bring this initiative to every birthing hospital here in the state. Oklahoma was the first to do this and is almost there. We've just launched our final cohort and gotten to every single birthing facility in the state. And involvement of community midwives is really key to spreading this initiative statewide and reaching all people giving birth across Washington state. With that kind of brief overview, I'm going to turn it back to Misha, either to fill in what I forgot or to transition to some of what TeamBirth is all about.
Thanks, Lindsay. I will talk about what TeamBirth is, but if you have any specific questions about Ariadne Labs, anything that Lindsay just talked about, we would love for you to just make this an interactive chat box or anything like that. Lindsay can kind of watch that and see if there's anything else. But I want to talk for a few minutes about what TeamBirth is, then I'll have Melissa kind of check in with you all about kind of smooth transitions and all of that, but then we'll get back into really hearing from you all about what you would want to know more about TeamBirth in relationship to that instructional material that we're starting to develop. So really what TeamBirth is, it's aimed to be a behavioral initiative. It is aimed to kind of live in that solution that Lindsay was talking about, the things that hospital personnel, particularly in maternity care, know should be occurring, but there's a gap in how things actually end up happening or getting translated or care gets perceived and understood by those that are birthing. So TeamBirth is built to really support and standardize the behaviors around communication where oftentimes gaps tend to be. And I'm assuming I'm saying something that is all too familiar to you all. So what we're trying to do is, through teamwork and simplicity, take 4 key communication behaviors and try to standardize them, much like you would have a hypertension or a hemorrhage protocol or a hypoglycemia protocol for a newborn. There is some standardization to this, but I'll talk more about how that's really just the beginning of TeamBirth. So the standardization is of these behaviors that you see here. They should seem very basic to you, but as we all know, the point of standardizing is to make sure they occur for everybody, every time. So the first behavior is to really make sure that during all key decisions and any major changes in clinical care, that a conversation takes place with these behaviors, that the team is clear and elevated and centered around the patient, that the patient and any of their support people and anyone from the community that they have been previously or currently receiving care with are part of the team. And that patient's preferences, and not just the patient, but again, their support team and also everyone on the clinical team, that their voice is heard, that there is an intentional effort to elicit people's voices in a conversation, really trying to shift away from that top-down care. The next behavior is talking about the plan with a framework. And the framework, I'm going to get into quite a bit with the guide, but the framework is really centered around, if you think about it this way, what's going on with me, what's going on with my baby, and if in labor, what's going on with labor progress. And talking through what is going on in those 3 categories helps us say very clearly why we may be talking about an intervention or why we're reassured that we have that much more time, kind of almost putting those things into buckets or categories. The last is just an intentional discussion about situational awareness. You might think of it as closed loop communication or just being transparent about why we might need to have another conversation again. And that's it. It's those really obvious behaviors. But a lot of times those conversations take place in pieces. The upper right corner of this slide kind of shows especially what happens in hospital settings often. There's conversations in the hallway. There's conversations between the nurse and the patient, and then the nurse might go out and have a conversation, especially a patient that's maybe kind of transferring or maybe being evaluated in triage. Are they going to stay and have hospital care, maybe go back to their community setting? There's often a lot of telephone game or hallway talk. These times, even when everybody does come into the room together, that conversation can still feel very linear, that it doesn't actually take into account the lived experience and the knowledge of everyone that is part of the team. Who are we having a conversation about? What is the decision at hand, and how is that affected by the people that have come together right now? So really simply, a team birth huddle could look very simple, just like something like this, where we're having a conversation, we're naming that it's a huddle, and then this other component, so that's one component, just a team coming together and having a conversation, usually called a team birth huddle. And the other component is just usually a dry erase board or some kind of visual tool that calls out those behaviors, almost like a script or a prompt to remind everybody in the room, you know, to elicit those behaviors, to try to consistently talk about the plan in those transparent, shared decision ways. Calls out exactly a little bit more about what are some of the components of the huddle. For now, I'll just say the who. It really is the care team, of course, including the person in labor and their support. We do really intentionally call that out very clearly, that a person in labor is integral in their healthcare experience to the level at which they wish to participate, very intentionally. And then, of course, anyone that's part of their care team that is a decision maker or has input in the decision at hand. And I will turn your attention to the when, often at admission. And I think I said this before, but just to be really clear, at major decision points or changes in care plans throughout labor and postpartum. There, of course, are many times to have a huddle. I hope that you're thinking about the times. Obviously, one of the main times that we're going to talk about with you and hear from you about are those transfers of care from the community into the hospital setting, often, of course, not planned. So the next slide just shows the other component of a team birth huddle, which is that shared planning board that I talked about. This is a template. This is what we bring to every hospital and say, we really want your boards to now be patient facing. They are no longer message boards just between clinicians, but they're really to house the details of the conversation. Teams do sometimes add other things, but hopefully the theory is that every team birth hospital, the whiteboards in the labor and delivery space, sometimes even triage and getting better and better at postpartum, have these components on their board to be intentionally conversation facing. The next slide shows a couple examples of them. I know it's hard to see it on a template, so sometimes it's fun to actually just see a dry erase board in action. I like these two because they show that whether or not you have this, beautiful handwriting, or my friend in Mississippi there who does not, but really loves writing on the board, that they're really meant to be dynamic in the moment, capturing who is there, what are we talking about? And another really key component that gets messaged to hospitals is really anyone can write on the board. To welcome in. We spoke with doulas yesterday, and to say, you know what, if a family comes in and they have a doula with them, hand them the dry erase marker as well, invite them to add their name to the care team. And that would be obviously for any of you all that happen to be at a team birth huddle as well. I mean, I could talk about this for hours. It's my passion, and I see it over and over. The more teams at hospitals are true to the fidelity of what team birth is by using those simple components, really the concepts that we're trying to bring in a standard way, they're pretty complex. It's making sure there's psychological safety, that everyone in the room can speak up, that everyone's experience and knowledge is valued. It may be different, but it all has a place in a team birth huddle, and that there's actually an opportunity for shared decision making and really calling out transparently that situational awareness. All of those things together really do elevate it from just a standard of care that's being adopted at hospitals over and over again, but actually an opportunity to provide equitable care. A team birth huddle board should look different for every person every time because we're listening. That yes, we are beginning to make this an industry standard, as we like to say, but really it's because it is being adopted more and more and more in hospitals, it's being seen as a standard of care, but it's a standard that really has an opportunity, along with so many other efforts for birth equity, to elevate that individual care, that equitable care that each person deserves to have. So that's really what TeamBirth is. I tried, Melissa, to say it as fast as I could so that we could get into it, but I'll hand it back to you to just kind of weave in, kind of do a little check-in on knowledge about smooth transitions and all of that, so that we can hopefully kind of weave the two initiatives together for this group.
Yeah, so thanks, Misha. I think that you guys can start, understanding now why smooth transitions and TeamBirth works pretty well together because of this transfer scenario. And I feel like most of you on this webinar are probably pretty familiar with smooth transitions. So Sarah and I are just going to go pretty quickly through our material. I feel like sometimes just a reminder of everything we're doing is helpful for you, because we're doing a lot of things. So I think that, our intention is to bring together all these different groups: community midwives, hospital providers and staff, EMS, doulas, and clients, all to work together around these transfer scenarios. So we just wanted to give you all a graphic on how many states are actually these days reaching out to us and trying to, in some way, emulate smooth transitions. And I just really want to share this because we have it here in Washington, and it might be something that we take advantage of, whereas other states are so wanting to have these meetings and these protocols and these conversations and these surveys, opportunities to give their feedback, kind of fill that feedback loop. And it's happening here, and a lot of states are looking at us. And I know I've said that before, but I think it's great. There's just this huge kind of momentum right now for community birth, community midwives, and transfer improvement. We're working on soon putting out an AIM resource toolkit that'll probably come out in the next month or so. So be looking out for that. And there's just a lot of attention on this.
Hey, everybody. I realized I didn't introduce myself at the beginning. So I do know a lot of you, the midwives around, but just for context, I'm Sarah Davidson. I'm the Smooth Transitions program manager. So that sort of scooted into that spot when Melissa moved to a co-chair position last year. So that's me. I was a licensed midwife also, so but no longer practicing. So I just felt like I needed to put that out there real quick, because you might all be going, wait, who's Sarah? So just to talk real quick about the sort of history of smooth transitions, it was launched back in 2009. It was created by a work group comprised of community midwives, OBs, a consumer, and a representative from the Washington State Department of Health. This history of smooth transitions really speaks to the importance of having midwives having a seat at the table. And out of that came what you probably all know, which is the transfer guideline for the indications for discussion, consultation, and transfer of care in a community-based midwifery practice. Since 2018, it's been housed at the Foundation for Healthcare Quality, which is in Seattle, based out of Seattle. It's a neutral 501c3 that houses several other healthcare quality improvement programs. So there's now about 25 hospitals participating in smooth transitions, and they're at various levels. Some have just had an initial presentation, and some of them are fully moving through the program, which I'll talk about those components in a little bit. But it's important to note that 20 of these hospitals, they account for over 75% of the births that are happening in Washington State. So currently we're getting ready to onboard Capital Medical Center, some Spokane hospitals, hopefully Samaritan in Moses Lake, and hopefully some of the Swedish hospitals in the area in the state. So I'll talk here about Smooth Transitions mission and goals. Our mission is to address our shared responsibility for improving hospital transfers from planned community-based births to promote greater patient safety and satisfaction. And we're really working to improve the whole person's safety and efficiency of a transfer process through system-wide protocols. And when we talk about whole person safety, we're really talking about the program's commitment to enhancing the emotional, psychological, social, cultural, and spiritual well-being of patients, not just their physical safety. And then working to collect and analyze transfer outcome data for the purpose of quality improvement, building greater collaboration between community-based midwives, EMS, and the hospital care team, and to enhance the patient experience of care when transfers occur. Yeah, so this is just, I won't go through all this, is just a list of the groups that support the work of Smooth Transitions. It's important to highlight the multi-stakeholder buy-in, especially from state level groups, because it really helps validate the program, gives it exposure, and helps with some funding opportunities. And our program is led by an interdisciplinary group, and we meet quarterly. There's representation on that group from OB, CNMs, EMS, LMs, the Hospital Association, Washington State Hospital Association, Pediatrics, Neonatology, MFM, Nursing, Department of Health, the HCA, a doula, and a consumer, all on that group that really help.
Yeah, so I don't know if you all have seen any of the 2022 data on community birth, but we wanted to share this. It's still about 4.6% of the total births in the state. And we did some kind of back calculations, and I think that that's probably roughing out to be around 500 or so, maybe give or take there, transfers that are probably happening. So this is something that's significant. I always in these presentations like to highlight the, study that was published a few years ago, 2021, in the Green Journal from Washington State, specifically Moz data, 5.5-year period, over 11,000 births that were looked at. And I think the take home messages here, I don't need to tell you all this. This is all your data, and you know this, but 86% of these births are occurring in their intended setting. Great C-section rates overall, great physiologic birth rate. And then the next slide has the transfer stats. There is, as we know, a difference in null-up and multup transfer rates, and then kind of C-section rates for those that transfer, and then just other rates there. So, really great statistics. I think the most important thing about this is just pointing to the value of statistics. When we go around the country and we make these presentations to different groups, hospital associations, Department of Health, they want this kind of data. It helps drive change. And so that's my plug for data. And we'll talk a little more about the program components, which I know you all are aware of.
Yeah, I'm gonna try to just move through these pretty quick because I know we want a lot of time for discussion. And a lot of you do know about the program components because I know a lot of you participate in the Smooth Transitions perinatal transfer committee meetings and whatnot. So, and many of you have filled out surveys. And I think just highlighting the fact that these components all have they each play a really important role in this whole quality improvement cycle. So, we start with a hospital presentation to just the folks at the hospital. If a hospital, and that can come from a request from a community midwife, for instance. We get that a lot of the times where there's a community midwife who's like, hey, I want to transfer this hospital. They're not participating in Smooth Transitions. Can we reach out to them? That would be great. Sometimes it's from the hospital themselves. And sometimes we're just identifying a need in an area. So once a hospital decides that they'd like to participate, we find a group of champions within the hospital. So like we need provider champions and nursing champions, people who are really committed to improving transfers. And then we find a community midwife liaison in the community who also feels the same way. And then we get together and we work to co-draft some transfer guidelines for that hospital. And then we share that with the community. It gets shared with the community for feedback. And once those are sort of go live, and people start using them, then we start meeting regularly, usually quarterly, to talk about several things in those meetings. And so we invite any of the community midwives who might transfer to that hospital, doulas who might be supporting clients who could transfer to that hospital, and then folks within the hospital care team, the staff. And we come together and we talk about how transfers are going. We talk about updates, community updates, hospital updates. We talk about any kind of resource development that needs to happen. Do we need to work on the transfer protocols, things like that? And then there's always a dedicated time to talk about the survey data, which is our Smooth Transitions developed some online survey tools to collect qualitative data about experience from all of the different players that participate in a transfer from a community birth. And that's including the community midwife, the client, the doula, if there was a doula present, the receiving provider, nursing staff, and then we also have a survey for EMS if it was an emergent transfer. And within those surveys, I think I can just talk about this now real quick. Within those surveys, we ask a lot of questions about patient experience. That's really the goal here, is to collect that information. But we also have TeamBirth focused questions in some of our surveys. So we're really wanting to get data about how those are working, if they're happening, how they're working, and how it's contributing to people's experience of these transfers that are happening. And then really coming together outside of a stressful situation, which we all know on this call, like a transfer can be a really stressful, kind of high emotionally taxing experience. And so these transfer committee meetings are really great because they bring everybody together outside of an experience like that, and get to know each other, build relationships, and can do some problem solving together in a positive. Yeah, and this is just here, we just want to highlight again, like how important these surveys are. We're capturing really important demographic data. Our client surveys incorporate some questions from validated tools from the UBC's The Birthplace Lab and others. We're measuring patient experience of abuse, mistreatment, autonomy, respect, and decision-making. And so, we're asking questions of receiving providers, nurses, doulas, and midwives about whether or not they feel their race, ethnicity, gender identity had any influence on their interactions. And then, hospitals are really interested in hearing this data. And so for hospitals and community midwives who are participating in Smooth Transitions, we can really bring parties together. We can talk about how things are going, look at this survey data, and attempt to find solutions together. And also want to mention, we have I work on these directories often, actually. Many of you get communication from me about these directories and making sure that I have that Smooth Transitions has as much information, contact information for you all in the community, to share that with the hospitals so that at any point in any time they can reach out to you if they have questions about care, if you're not there, that sort of a thing. So that's what those are doing. I'm sharing those directories with folks. I think.
Yeah, and I can just add that, as Misha said, these TeamBirth huddles that are happening, not just like at that kind of patient handoff moment, but maybe and hopefully multiple times throughout that patient or client's care, if the community midwife has already left, we really want there to be an easy ability to, if there was a huddle happening, it was an important time, the midwife needed to be present, they can be phoned in or Skyped in or various ways, but included again, even if you're not physically there. I mean, so that's part of the reason why we've been building that piece into our transfer protocols, if you've noticed. And, you know, Sarah's been working really hard on those directories to really get that, you know, multi-directional communication going on between the community midwives and the hospital. These are things we're working on. Again, we're kind of constantly working on this protected review process, and we still are. We ran 2 pilots last year, bringing EMS and licensed midwives together around postpartum hemorrhage. And our goal this year is to actually involve the hospital in those simulation trainings and hope to do 1, but maybe 2. We're still really trying to hone down on our model of what is the best way to kind of be sustainable and to scale out these kind of trainings. Of course, working with TeamBirth. And we're also, like TeamBirth, very invested in working in Oklahoma and possibly another state pretty closely, Iowa. And then we've helped quite a bit in the development of the community birth data registry, the CBDR. I know you all have heard quite a bit about that, but that data will be pretty, I think, informative to us when it comes to tracking transfers and outcomes and just counting them. So I think that's it for us. We're happy to hear, you know, answer any more questions about smooth transitions too at the end of this.
And yeah, and so hopefully that it's making sense. The kind of the integration of TeamBirth and smooth transition, and really looking for what does that mean for a community midwife? Like where does that intersection come alive for you? And I do want to say again, I think that all of these different things coming together, there really isn't going to be one perfect solution for really consistently elevating birth equity. But I love an opportunity to really weave in things and weaving in smooth transitions and TeamBirth to elevate community birth workers and having a tangible way to do it is really exciting. So I hope that you'll see even something as small as this 1-pager informational could be really helpful for that. Yeah, and so I'm just kind of refocusing you because I want to look at the guide together. So what we're trying to capture is some very basic things about TeamBirth and how it weaves together for community midwives. And can we capture all of that on a 1-pager that could live both at hospitals and in the community space? So there's consistency, especially now that so many hospitals in Washington state are receiving TeamBirth training. So reminding again, it's really the huddle and the structure around that visual tool. Reminding again the power of something as simple as being really clear during a TeamBirth huddle who needs to be here for this conversation. You know, Melissa pointed that out really well. For community midwives, obvious, there's going to be a couple real obvious ones, but I think depending on your work and your work streams, and we'd love to hear more from you, there may be some other really key ones to call out as well, but making sure that it is very clear to the hospital teams that we are training in Washington, where the community voices make sense for huddles. And then this is another thing I talked about just a little bit, but on the next slide, it highlights it again. So remember when I was talking about those key behaviors of the team, the preferences, the plan, and the next huddle. Those are sort of the things you'll see on a TeamBirth board. That plan section has that kind of almost like subcategories, those buckets I mentioned of what's the plan for me, what's the plan for baby, what's the plan for labor progress. And you'll see those on that dry erase board. We also have some other tools around some of the key decisions that really affect clinical outcomes too. Admission, you know, especially birthing folks that are planning to give birth at a hospital, when to come in labor, and then also when to talk about interventions, when to talk about things like adding Pitocin, or how long is the right appropriate amount of time for water to be broken before a provider's going to recommend a Pitocin or internal monitoring, and really even assisted delivery with a vacuum or C-section. So we have support guides around those key decisions. They're also broken down in me, baby, and labor. And it seems very logical that the one page guide, it's really a front and back. So the guide that speaks to transfers from the community to the hospital setting also has that same format, that there's a call out of that discussion. Really simply, why are we having this transfer? And does everyone agree and understand? Obviously, a very simple one is baby's doing great, labor progress is great, that we're choosing to come for some reason about me, my body. Maybe it's I've changed what I want for pain management, or all the other way around, that we're being really clear. I'm doing great, baby's doing great. We've now come to the conclusion that for labor progress, there's a reason that now we're transferring to the hospital. Knowing that going in to that transfer, having that be a really clear key component of the huddle at transfer time can really help level set the room. And I'm sure that happens. And that's something you all are trying to communicate when you get to the hospital, and sometimes in phone calls before, but calling out that structure every time and utilizing the structure of the huddle can be really helpful. So this slide really just shows that all of the tools, the first one is an excerpt out of the guide that I'm actually going to ask Lindsay to go through. Draft of a guide that we have had some feedback about, but we would love more. So I would love to know, and in a moment, of course, we'll give you don't have to answer it all right now, but if you have like immediate feedback, you immediately see something you like, or you're like, where is this other thing? We'd love to hear it right away. Somehow in a one-page front and back, kind of piece of paper, we want to somehow capture TeamBirth and some of the call outs. So Lindsay, I don't know if you want to elaborate on that part.
Yeah, definitely. Thank you, Misha. And I just popped in the chat, or what you're looking at on this slide, like Misha was saying, is snippets from that one pager. To be clear, it's a one pager front and back. What I just popped in the chat is a public view link to how the document would actually look. The front page of the document is more oriented towards kind of more generic information around what TeamBirth is, the rationale behind it, the different components of the shared planning board. Kind of, we're looking at it as the knowledge that everyone needs to know. This one is slightly tailored towards the community midwife role, but for the most part, it is information that we could hand out to multiple different roles. And then on the back is very focused on specific kind of community midwife considerations. So if you have limited time to take a look at this resource and provide feedback, definitely start on the back, because this is the content that we have changed the most and really shifted to make it as applicable as we can to your role. We've highlighted some of those things here, like Misha was saying, in the other considerations section, breaking down the information into the birthing person, baby, and labor progress that is replicated on some of our discussion guides. So with that, also, as Misha said, we want your feedback. We have taken an initial stab at kind of collating this information, and with collaboration from Melissa and Sarah, but definitely want your voices and your experiences to be reflected in this resource, which is why we also shared a feedback form with you that we'll be using. We'll keep it open for the next couple weeks so that you can kind of revisit this resource and provide feedback. But as Misha was saying, we have some time right now. If, as you take a look either at that link or what you see here on this slide, or anything that we've shared thus far in this presentation, we'd love to hear some thoughts and feedback for discussion.
Yeah, and Lindsay, there's already a couple comments in the chat about language. And I want to also take one step back. So this particular guide would be the audience is you, community midwives. Obviously, sort of a secondary audience is the hospital team. The teams, when they implement TeamBirth, get a lot of training and education from us, but knowing that this is the information that helps them understand the community midwife. And we also, again, we are developing one for doulas. We went over yesterday, so it's almost the same, but it has obviously some specific call outs on the backside, like Lindsay said, more specific to that type of provider. I do want to kind of call that out, that this one would be kind of you facing. The tools that were a couple slides before, you don't have to go back, Brian, but the tools that I talked about that are around decision for labor admission or interventions, those take the guidelines that hospital teams follow, ACOG, SMFM. They take the guidelines that teams are supposed to be following and those standards, and they shift them into what we call patient-friendly language. Yes, that one that you just saw is in English, but as you all know, there's a lot of translating that happens even when everybody speaks the same language. There's all this translating between medical terminology and procedures and all of those things. So that's actually part of the first part of training with TeamBirth, is that during huddles, things that go on boards and things that we're talking about, we're trying to actually remove medical terminology. It's not the documentation. It's not their chart. This is what are we discussing? And let's put this in very, anyone's terms. We look at literacy levels. We try to, train folks to use 2 or 3 words, avoid multi-syllable words, things like that on the board. And then, even though, of course, there's always going to be these barriers about limited availability for translating services, utilization of translating services when they should be used appropriately in hospital settings. Even so, making sure that we make sure that the conversations are already patient-friendly language. Then we take the next step to translate from there. So those patient-friendly guides that I showed you, we do have them translated in lots of different languages. And of course, if you are ever, working with a client and English is not their primary language, and you go to a TeamBirth hospital and they only have the guides available in English, it's a great opportunity to remind them, hey, I heard from TeamBirth. I know these come in other languages. So what we're really hoping is to find a way to really collaboratively improve these kinds of conversations in language. So yeah, anyway, I just wanted you guys to know that the current discussion guides are in lots of languages. And thanks.
I'm trying to refer to back maybe a couple slides or so, like when we were talking about admitting folks in the hospital setting, like administration staff, and this input is even very fairly recent, where the whole hospital that time, couple of times in a row, were not able to produce any document when it comes to consent or anything they wanted the patient transferring to the hospital. They were not able to. The whole hospital system did not have it, or said they could not produce it. And it happened twice in a row, enough that it is a concern, and it takes several hours to translate that as a transferring provider or to assist in that navigation. So I just wanted to, I think it's maybe one slide or a couple slides back. Sorry, it took me a while to type my what I
No,
had
that's
in
okay.
And also, let us know what hospital that is, Sarah and I, and we can kind of push them to have more resources available in the languages you're referring to. So can you send us an email about that?
Okay, yeah, I will.
Because this sounds like it's not necessarily TeamBirth related, but more just that particular hospital's not meeting the needs of the patient population that it serves adequately, and especially in these legal consent documents. Okay.
Yeah. We love
have
having, TeamBirth as an excuse to, help hospital teams see where those gaps are. So thank you for, bringing that up. It's really helpful because we have these touch points like Smooth Transitions does with getting to meet with the hospitals through this program. So that's really helpful to hear. Sorry,
Yeah, and I'm
Melissa, go ahead.
seeing, that's okay. I'm just seeing Liz's comment about, and this is something that I know we've talked in our small group about this, about that kind of opportunity for huddling on that hand back to the community midwife. And we often build that in our protocols as well. But Misha and Lizzie, can you all talk a little bit about how TeamBirth is kind of moving in some of these directions, or, interested in these points too, because that is a really tricky and relevant piece to the community midwives, and a place where information can get lost or confused.
Right. And Rua, will you really quick talk about the gift cards?
Yeah, we really appreciate everyone's feedback so far. And so if you have a chance to fill out the feedback, you'll be entered in a drawing for $50 Visa gift card. But just wanted to encourage everyone to take the time to look at the guide, listen, make any relevant feedback that we can update before we kind of finalize this guide and share it out with you all.
Yeah. And so thank you, Rua. I really appreciate that. And so I'm still kind of on Liz's comment. Is it Liz? Sorry. Yes, Liz's comment. That's one that would be really helpful because we know that there is a little bit of a variety of involvement, kind of depending on community midwife practice about that hand back. I know it looks different in different settings. I'm not the expert. I only know what I've seen at various hospitals, and I know there's some variation. And what we want is for this guide to make sense and to call that out kind of across the setting. So finding a way to bring it to the forefront without being too specific, if it's not the same practice for everyone. Melissa, feel free to chime in, but I know that one was kind of one of the really key points that we want to make sure to call out. That we could definitely use feedback about.
Yeah, I do see that on the community midwife one pager, but I think it's maybe would be more helpful to see it on the hospital side, because I think they forget, we're really interfacing at the time of admission, but then once everything's said and done, they're just carrying everything and they sort of forget that we are still interested in what's been going on and we're going to be helping the clients facilitate. So I think it's more needed on their side than on our side, because we're definitely remembering what's happening and taking our clients back.
Yeah, I would agree. On the hospital side, I see it as a real opportunity. I mean, there's usually, even if it wasn't a community midwife transfer, upon discharge, there's a whole bunch of information that's being given to the patient, follow-up visits, even if it's not with a community midwife, maybe it's a pediatric provider, and it's another opportunity to just come together, and the communication with the midwife can just be one piece of it. But it's often a drop piece even among just regular hospital clients.
But Liz, what you said is really, really helpful. So what originally when we started TeamBirth, it was very, very, very labor and delivery inpatient focused, testing it, trying to figure out what can we standardize, what's feasible, what will people do, what can we have them do. Now that it has grown, I will say a lot of hospital teams are looking up and out. They're doing better. They're figuring out, yes, we can do this. And how can we get better about doing this, not just for the patients where everything's straightforward and easy and they speak English and they're not a birth center transfer, right? But how can we do something? And yeah, okay. So in saying that, it's a little bit of we're trying to line up, community and inpatient at the same time. There is going to be a lot of push-pull, I'm sure it helps us educate the inpatient staff more robustly when we've also communicated what is TeamBirth and how can community midwives participate in it as well. So when both of those angles are coming, it's very helpful. The onus absolutely is on the hospital team. We tell them that all the time. But also, everyone can ask for a huddle. As one of my midwife colleagues says often, anyone can ask for a huddle. The patient shouldn't actually even have to. but anyone can ask for a huddle. So yes, the onus is on them. It can be very helpful in that next huddle section of the board. When a midwife leaves, you're right. How does a postpartum nurse randomly know, okay, this is a patient, I really should pay attention because their care is going back to the community midwife? That could be something that's really called out in that next huddle section. Around discharge, we're actually going to call the midwife who went home yesterday, right? But we're going to call and we're going to put them on speakerphone. Huddles are not an emergency. So we should be able to get a huddle together, call that midwife, put her on the phone, the speakerphone, if she can't come back in, and have the conversation about discharge and the baby's plan go. I want to make sure in our last couple minutes we answered these questions, but Lindsay, do you want to describe this slide? Because I think people will answer some of the questions in the chat.
Yeah, definitely. Thank you, Misha. And I will tell you all, I'm sitting in the room with the person who created this slide. This is another one of our phenomenal researchers here, Kaya. And what you're looking at, these are the first two cohorts in our Washington statewide TeamBirth implementation. So as you can see, they're kind of scattered all around the state. Cohort 1 had 15 sites in it. Cohort 2 is 6 or 8. Kaya, is that correct?
About 8.
About 8. And we actually just kicked off our third cohort, which is closer to the size of cohort 1, so around that kind of 15 to 17 hospitals. So as you can see, we're scaling that this initiative. You're part of something much larger here, and it will be our second fully statewide implementation project with TeamBirth, which is really exciting to see. And like we said towards the beginning, community midwives are essential to really spreading this initiative statewide and making sure that we do reach birthing people giving birth in all settings across the state.
Yeah,
Yeah, and
so
I want. Oh, go ahead,
yeah,
Melissa.
go ahead, Misha. Well,
Oh,
I was just going to say that when we finalize this guide for community midwives, I know we'll be sending it out to WARM, Moz leadership. It'll go on our Smooth Transitions resource page. So it'll be available, and any other resources, the doula one is going to be spread. You know, any other resources, especially I'm thinking if we end up in the future developing like a kind of a patient facing or client facing TeamBirth resource, will be, you know, having that information on our website. And I know that TeamBirth has a link on the WISHA website. So that's the Washington State Hospital Association, and all of the hospitals. Like if you don't see them here in cohort 1 or 2, they're in other about, you know, next developments or steps or resources that come out of this work together. Sounds good. Well, thank you all. Have a good rest of your week.
Thanks, everyone.